Testing scapular elevation against gravity position. Patient will be seated. First thing you have your patient do is bring their shoulders to their ears as close as they can. So go ahead and do that for me, Owen. And now bring them back down. Because he's able to do that, I know that he's at least a 3. Now come about halfway, Owen. I'm going to apply resistance down on his shoulders. Resist me 3 seconds. 3, 2, 1. Back down. Now for this, you'll want to apply quite a bit of weight, as the scapulas can bear quite a bit of weight without giving away. Testing scapular elevation, gravity eliminated position. The patient will be prone. First thing you have your patient do is perform scapular elevation to the best of his ability. So go ahead and do that for me, Owen. Bring it back down. Because he's able to do this while being supported by the table, we know that that is at least a grade 2. If I do not see any movement going on with the shoulders, then I will palpate the upper trapezius and the levator scapulae found here. If I feel these muscles firing, that is a grade 1. If I do not feel them firing, that is a grade 0. Testing scapular depression against gravity position. Patient will be in a prone position with the arm approximately 150 degrees into abduction. So go ahead and do that for me, Owen. Bring that up. There we are. Now on what you also want your patient to do is make sure the thumb is pointing towards the ceiling. Now I want you to bring your thumb towards the ceiling as far as you can go. Now back down. Because he's able to do that range of motion, we know that he's at least a 3. To test for a 4 or 5, what I'm going to do is I'm going to have him come up about halfway, and then I'm going to apply resistance underneath the inferior border of the scapula and the vertebral border, and I'm going to force him into elevation while he is going into depression. So go ahead, sorry, you want to come up halfway? I'm going to push down into you. Resist me 3, 2, 1. Let that back down. If he could not perform any range of motion against gravity, or if the motion is minimal, I would consider that a 2. And if he is not able to do any range of motion while in that position, then I would palpate for the middle trapezius, the lower trapezius, and the rhomboids found about right here. If I feel these muscles firing, that is a grade 1, and if I do not feel them firing, that is a grade 0. Testing scapular adduction against gravity position. Patient will be prone with the shoulder approximately 90 degrees, elbow also approximately 90 degrees. So bring those up for me, Owen. Just like that. There we go. Now, Owen, what I want you to do is I want you to have, with this arm, I want you to bring this arm as close to the ceiling as you can. So bring it towards the ceiling. Now bring it back down. Because he's able to do this against gravity, I will rate him as at least a 3. Now I want you to come about halfway, Owen. Now, I will apply resistance on the vertebral border of the scapula, pushing him into a abduction. So go ahead and resist me, Owen. 3, 2, 1. Let that back down. According to how much he resists me, I will rate him as a 4 or a 5. Testing scapular adduction. Patient will be in a seated position with the arm supported just like this. What I will have my patient do is perform shoulder abduction or scapular abduction while in this position. So go ahead and do that for me. Now bring it back. Because he's able to have any range of motion here, we know that that is at least a grade 2. If he does not have any range of motion, I will palpate the middle trapezius or the rhomboids found on the vertebral border of the scapula. If I feel these muscles firing, that is a grade 1, and if I do not feel them firing, that is a grade 0. Testing scapular protraction against gravity position. Patient will be supine. They can also be in a seated position. You can do either, but I just like to have them in a supine position because the scapula is better supported while laying down. So Owen, what I want you to do is I want you to bring your arm up and I want you to punch towards the ceiling, but make sure to keep your elbow straight. So go ahead and punch forward and now back down. Because he was able to do this against gravity, I would rate that as a 3. Now I'm going to grab on the distal end of the humerus and I'm going to push him into retraction. So go about halfway, Owen. Yeah, there we go, about halfway. And while stabilizing the scapula. So I'm going to resist me, 3, 2, 1. Let your arm back down. And depending on the resistance that it gives me, I'll rate him as a 4 or a 5. Testing scapular protraction, gravity eliminated position, patient will be seated, forearm supported. If we were not in a clinical, or if we were in a clinical setting and I did not have a platform such as this, I could support him with my hands. But since we have it, we're going to use it. Okay, what I want you to do is, Owen, is I want you to punch forward but not bend your elbow at all, okay? So we just punch forward and then come on back. Because he's able to do this with gravity eliminated, that is a 2. If there's no movement, I would palpate for the serratus anterior found about right here. If I feel this muscle firing, that is a grade 1, and if I do not feel that muscle firing, that is a grade 0.